One of the most powerful techniques we can use to help us, especially if we're dealing with chronic back, hip, or pelvic floor pain or dysfunction, or if we've been dealing with a chronic condition or increased stress or anxiety, is a 360-degree breathing technique. So I'm going to walk you through it, but essentially what we're trying to do with this technique is take our body from a sympathetic fight or flight state and bring it down into a parasympathetic calming state. That is going to help improve circulation, decrease the sensitivity of our nervous system to the pain receptors, and also just better connect with our body so that we can start to move better throughout our ribs and our back and our hips so that we don't keep building on tension or tightness and feeding into pain. Now, with the 360-degree breathing, you're essentially going to think of filling up air all the way around your body. So it's going to be an inhale through the nose and an exhale through the mouth. And as you're inhaling, I want you to think of filling up your lungs from the bottom up. So you're inhaling, air is going down into the lungs, going all the way around the trunk, and then rising up, as opposed to just breathing into our upper lungs and our shoulders and chest. There's a couple of cues I'll walk you through, and over the course of the technique, our goal is for everything to be moving and working together. But it can be deceivingly challenging at first. So if you need to break down the cues or focus on one step at a time, please do, so that you get comfortable with the mechanics of this technique. Now, initially, we're going to think of just getting that diaphragm moving. So as you're inhaling, thinking of our diaphragm here, our abdominal area will extend out or up if we're lying down. And that's going to allow us to increase the depth of our inhale. As our diaphragm is moving outwards, we want to think of our low back expanding backwards and our ribs expanding outwards. As we continue to inhale and increase the depth of the breath, we're also going to try to get that pressure into our pelvic floor muscles to help lengthen the muscles and reduce any tension or guarding that may be present. Now, you can practice this in a couple of different positions. I feel like lying down on your back with your knees bent is the easiest position, but we'll cue you in a couple different ways and you can try the situation that works best for you. If you're sitting, I want you to think of inhaling and feeling your sits bones slightly separating. So taking that slow, deep inhale, and as you're inhaling, you should feel the sits bones slightly moving apart. If you're sitting in a chair that has a back against it, you can also cue yourself to breathe your back into the chair, or you can keep your hands on your ribs. And as you're inhaling, your ribs should expand out. As you're exhaling, everything comes back in and helps push the air out of your body. If lying down on your back with your knees bent is comfortable for you, then I first want you to think of putting a hand on your chest and a hand on your stomach. And you're going to take a slow inhale through the nose, about 4 to 5 seconds, trying to breathe into your bottom hand before your top hand moves. And then you can exhale through the mouth. Now, as you get comfortable with that, I want you next to cue into your low back. If you need to put your hands behind your low back so that you can feel that tactile cue, please do. And you're going to think of inhaling, your diaphragm is going to come up, and your low back is going to press into your hand. For some people, it's challenging to coordinate both movements. So I recommend tuning into your low back and trying to just breathe into your low back, because if your low back is moving, your diaphragm will be expanding as well. The third cue is to place your hands around your lower ribs. And as you're inhaling, your ribs should be expanding outwards. You want this to occur before you notice a big shrug up of your shoulders or any straining in your neck. So we're filling a balloon of air. We're getting air all the way around our trunk, all the way throughout that balloon, into the diaphragm, into the low back, and outwards into the ribs. If we can coordinate that, then as we continue to tune into our body and take a deeper breath, you should feel some gentle lengthening of your pelvic floor muscles towards your feet. If you're unsure if you can feel that, you can place your hand just on top of your pelvis and feel a gentle lengthening of those muscles with your inhale. If this is challenging for you, you can also think of visualizing your sits bones slightly separating as you inhale and that air pressure goes down into your body. Then on the reverse, if you want to think of exhaling through pursed lips, so you're going to think of pulling up and in with the pelvic floor muscles, and then everything around the abdominal area is compressing to expel the air out. So 4 to 5 seconds slow inhale through the nose, filling up air all the way around your body. And then a slow, long exhale through your mouth, pulling up and in.